What's happening, guys? Welcome to Dr. Bradley Petrie's math lesson. When we're taking a look here, we got a little math problem that we all should know, especially after last week's Jeopardy. Optimal health is equal to drinking water plus eating healthy plus sleep plus exercise plus, most important, getting adjusted. Now, I think it's really interesting. We talked yesterday about how we needed to nip this subject. A lot of times we'll call it future pacing. And maybe I'll sneak in a little bit of our favorite videos from Rocky, da-da-da, da-da-da, with the old man, who I can't remember his name from Waiting List Practice right now, but it doesn't really matter. When we're going through on this, most of our patients come in for a few different reasons. One, normally they're not drinking water, so that's bad. Two, eating healthy, sometimes they eat healthy. Usually they have zero supplements, so usually they're not eating that healthy because we haven't taught them how to eat healthy yet. Some of them do. Sleeping. Most of our patients feel like crap and they're stressed out and they're parents and they got stuff going on, so they're not sleeping. Most of our patients aren't exercising. In fact, when you ask a lot of our patients when's the last time you did a sit-up or push-up, they say 10 years or more. They're not doing that. And certainly because they haven't come into our office yet, they're not getting adjusted. So what happens? They end up fucked up. So our patients come into the office and they are fucked up and they don't know what to do with themselves. They're not happy, they're not healthy. They come into our office. All of a sudden, they start getting adjusted and educated. When they start getting adjusted, they start to sleep better because their nervous system is working better. When they start to sleep better and get adjusted, they start thinking more clearly, and then we start to talk to them about things like health and supplements, and we start to tell them to drink enough water, and we teach them that they need how many ounces of water? Half their body weight in ounces of water, 3 to 5 liters a day. And when we're looking there as well, we try and get them healthy to the point where a lot of our patients were maybe a little bit active, but now they can't be because they're in so much pain exercising. And all of a sudden, they're not this anymore. They are FA. Fucking awesome. And even more frustrating than that, they start doing great and they get to the point where they're feeling FA, and unfortunately they're like, hey, I'm feeling really good. Can I just do some stretches and exercises and feel better? No, because when you're not getting adjusted, you're not thinking right, you're not sleeping right. When that happens and you're not getting adjusted and you're not sleeping right, you stop exercising and you go back from this, when you remove this, to this. Fucked up. So the bottom line is we cannot erase adjustments from the equation. I know it's kind of silly, but it's totally true. It doesn't make any sense in simple math to remove something that had you feeling fucking awesome. And let's take away some things from that equation. What ends up happening? We end up a mess. So let's go through, let's tell people about this, about how to get to optimal health, and let's create lifetime patience, all right? I'll talk to you guys later.